Our goal is to find objective information that enriches the psychiatric diagnosis. And in order to do this, we are focusing fully on physiological measures. So we measure people in the scanner, for instance, so that we can assess their simultaneous brain activity. We do it with EEG also, but this we can do at home. We have the Psychophysiology laboratory and we have the virtual reality laboratory. We are trying to zoom in on emotions and of course also the emotional circuitry in humans as far as we can. So we have the behavior, we have the physiology, and we have of course the subjective ratings, and simultaneously we can have this view into the brain, for instance with pupillometry, which is kind of a surrogate marker for activity in a brainstem center, and of course with fMRI, in which we can say, okay, what kind of networks are becoming activated. And if you combine all of these markers, then we're getting closer to such a biological stratification of patients. And then we know, okay, this is a patient where there is this presence of hyperarousal. And then the next question is then of course going to be to the clinicians, what kind of medication would fit best? And then you can monitor this. Is it improving or is it getting worse in the first weeks? The best biomarkers, or in our case physiomarkers, are going to be the ones that are able to really monitor what is going on in patients and how do they respond to treatment and interventions, but also the ones that are translational in nature, meaning that we can assess the same physiomarkers in healthy human subjects and in animal models. We're still at the level where we have promising candidates, but we have no valid biomarker or physiomarker at this stage. We're coming closer, and it really depends on the kind of symptoms. One of the main goals would really be to find this objective clinical test that we can apply into the clinic. We owe this to the patients, we owe this to the clinicians that are working hard to improve the mental health of all their patients, and so far biological psychiatry hasn't delivered yet. And now with all of these technological developments, there are just more chances, more possibilities to get there and to really develop a medical device. And if we have the first medical device that can track physiology and is informative for psychiatry, yeah, that would be a great first step.